COVID-19 Command Council announced that the country is facing the possibility of a fourth wave by the end of the year. Now, medical experts predict that the fourth COVID-19 wave will start around the festive season, while some believe it could arrive even earlier. This would follow a similar pattern seen in late 2020 when high mobility between provinces and more frequent gatherings over the summer break led to a spike in infections. But what steps can we take to thwart the fourth wave, and how critical is the vaccine process in the rollout? Joining me to have this discussion is Professor Mosa Moshabela, Acting Deputy Vice-Chancellor from the University of Kwazulu-Natal. Prof, a very good morning to you. Thank you so much for your time. Where are we in regards to the current pandemic, the fourth wave that could be coming towards the end of the year? How do we begin to prepare for that?
Yeah, good morning to you, Bushe, and to all the viewers. I think that we are at a point where we are really optimistic about coming out of the third wave, which was driven largely by the very infectious Delta variant. And I think that, it's been very difficult, especially realizing that with the Delta variant, the curve coming down from the peak was not as smooth as we had seen with the first and the second wave. The third wave took much longer to sort of come to an end, and the provinces of KwaZulu-Natal, Western Cape, and Eastern Cape are the ones that are still lagging behind. But Gauteng and Limpopo are now out of the third wave, and so we're looking forward to the whole country coming out of the third wave. It looks like the trend is quite steady at coming down with those numbers that we're looking at. The positivity rate is now at about 10%. So, it looks promising, Bushe, and in a way it comes as a relief because of, one, the fact that, for most people, being in higher alert levels, like alert level 3, it can be a strain. But also, I think, given the fact that we are now in the election season, there's going to be really competing interest in terms of what is best from a pandemic point of view, and what is best in terms of people exercising their right. So, in short, I think that it is positive in terms of the third wave, but the concern will always be that we don't know when a new variant may pop up. We're busy monitoring that, and also we worry that people may become complacent and not necessarily really follow the prevention measures, and the election campaign can actually contribute quite a bit to gatherings that may trigger sort of an uptick in infections. Those are some of the things that we're worried about.
I mean, you speak about the new variant, Professor. We've seen a couple of variants of interest already, one in South Africa. You mentioned the fact that you're monitoring this. The first three waves were all driven, it seems, by different variants. How can we prevent, or at least try to contain, that specific variant, which I know it's something that is almost impossible right now?
Yeah, so absolutely. I think that when it comes to variants, what we have learned is, even though we had a highly transmissible variant like Delta, they can be controlled, but they come at a cost when the vaccination is very low. So surveillance will happen from a scientific point of view, and we will get updates in terms of what's happening in the world with the mu variant, for example, what's happening locally with the C12 variant, and to see to what extent those are actually influencing infections. So that will happen from a scientific point of view, but I think from a general public point of view, then it becomes really important that we do not forget that. We remember that, and we participate in a process of actively limiting the chances of any infection passing from one person to the next person. So we must not necessarily wait until a variant has taken hold, but as much as possible, and within reason, I suppose, try to carry on with the prevention measures until we get to a point where at a broader societal level we can say that some of these restrictions can be relaxed, as we are seeing in many other countries around the world where the vaccination campaign has been successful.
Professor, the devil's in the detail. Talk to us about some of those details from the first three waves, the trends that you have witnessed, and what does it now mean for even some of the regulations that are in place in the country, as well as some of the preventative measures, including our vaccination drive going forward?
Yeah, so it's important, I think, that what you're saying, Buhle, is the fact that these trends are driven by different factors or characteristics. They have different characteristics. But also, I think that what we know changes so fast that it's so easy for people to be left behind in terms of information. So we know with the first wave, we emphasized a lot issues of physical contact, issues of sanitization. But you would remember there was a dispute as to whether this virus can be carried in the air, in terms of when a room is closed or not. But with the second wave, we saw a variant that could escape immunity. So even people who had recovered from the previous infection could still get infected. And that's when we saw a very high peak of infections, but the highest peak of death happened during the second wave. It's a very beta variant is a very kind of stubborn variant, so to speak. And we came out of that, and when we entered the third wave, it was driven by the Delta variant, which was highly transmissible, can spread really fast, almost 5 times the original virus that we saw from one person to the next, driven largely by the Gauteng as an epicenter. And we also saw that it was very difficult for the provinces that were coastal to also kind of manage this pandemic, because it was delayed from the perspective of those provinces. They came in towards the end, but the infection looked like, the curve looked like it had a long tail. It did not come down straight down smoothly. However, what's reassuring is that the rate of death in the third wave it peaked at a lower level compared to the second wave. So in a way, you could generalize from that the Delta variant was highly transmissible, but it did not contribute to any increased mortality compared to Beta variant. So that for us, I think, it is in keeping with what we know in general about variants that become more transmissible, but in a way less lethal. However, I must say that, we cannot predict how the next variant is going to behave. The Mu variant that is taking hold globally seems to be similar to the Beta variant, perhaps a little bit more resistant to immunity. It's likely to escape immunity slightly more than Beta variant. But we shall see as to whether this will come to the shores of South Africa or not.
I mean, I also want to touch on that escaping immunity and the waning efficacy of the vaccines. We've heard of booster jabs that have been lined up and already being administered in certain parts of the world. How important is it for us to maintain the efficacy against these viruses?
Yeah, I think, at a scientific level, we are very curious about what's happening with immunity of vaccines. And I must say straight up that it's not easy for us to study natural immunity. People tend to ask a lot of questions about whether these variants would escape natural immunity and so forth. And it's very difficult globally to study natural immunity when we already have a gold standard of intervention in terms of the vaccines. So it would be unethical to a large extent to continue to study people who have not taken vaccines when you should actually be offering them vaccines. We have an old story in ethics of the Tuskegee trial, where even though there was penicillin available, people were not given penicillin for syphilis, and they were just observed to see the natural progression. And that's very unethical. So a lot of people, I think, demand specific answers in terms of natural immunity, but we have more specific answers in terms of vaccine immunity, because that's really the gold standard, and it would be unethical to study natural immunity, even though, of course, we will try and observe and try and grab what we can and share the information that becomes available from direct and indirect studies that are being done. So for us here, the most important thing is that we get people vaccinated, and then we ensure that both sides of the immune system, the one that looks at antibodies as well as the ones that look at immune cells, those two arms of the immune system are going to be jointly protective of people, and we can see how long that's going to last as we move through the time, but also how effective new vaccines, the vaccines are going to be against new variants. We are observing that, and that information will constantly be shared. So far, things are looking good. It's more important to get your first dose of vaccines for Pfizer, the only dose of vaccine for J&J, and then the second dose of Pfizer as well. As far as the boosters are concerned in South Africa, it's not yet a priority. It may be possible that the recommendation could be that people who have weaker immune system, maybe people who are much older, or people with chronic conditions or severe immunosuppression for whatever reason,
Professor,
they may be
if I may
encouraged
ask
to
you,
take.
just
Sure.
in closing, so there's obviously a shift in change that we've seen. The virus started with the first wave, and the talk was only the older people can get it, and now children have started to get this virus. Is that shift in age distribution in South Africa in particular as a result of the fact that schools were locked down, and as soon as July came, they will open up, increased movement? And what does that do for this pediatric vaccination drive as well that we are part of the trials for?
Which the shift is global, and it has a lot to do with the fact that we need a larger population of society to have immunity against SARS-CoV-2 virus, and also to ensure that even children and adolescents are not necessarily going to be negatively affected themselves from infection and disease and death. We have seen with Delta that, it can adapt the effects it has. When you protect the older people with vaccines, then you start to realize that the younger people are exposed. And also, in some instances, young people, because of their movements, they could contribute to the spread of infections through schools and other social engagements, sports engagements that they have. We've seen those outbreaks, and we want to actually make sure that even everyone is at ease, even parents are at ease, that their children are not going to pick up infections. If they do, then they will be protected as well. So that shift is global. In South Africa, it's necessary to look at it. And this trial that is going to happen with Sinovac is really important. We have seen SAPRA has approved the use of vaccines in those that are between 12 and 17. They will probably give us more reasons between today and tomorrow, as to exactly why they did that and how and where is the evidence, which we are very curious to actually see. It came as a surprise for some of us, but the Sinovac trial really is going to be really important in terms of us understanding the extent to which we can protect children as well, and they will contribute to population immunity.
Professor, thank you so much for your time. Let's leave it there. That's Professor Mosa Moshabela. He is the Acting Deputy Vice-Chancellor of the University of KwaZulu-Natal.